Hey guys, ladies and gentlemen, this is Rusty 78609 coming to you live and in color from Central Texas. God dang, I just scraped my arm. Anyway, I just called in to find out how much a prescription drug costs that my dermatologist recommended for my scalp, my head, because sometimes I get a little psoriasis. And anyway, so I called the pharmacy to give them my, quote, medical information, which I thought was Medicare, because that's all I've got. I've got Part A and Part B. I don't have any D, E, F, G, H, I, J, K, L, M, N, O, P. But folks, welcome to the world, Rusty, because what I found out was this. If you don't have Part D coverage, that little drug is $97. It's a little salve thing, $97. So I thought, well, that's crazy. So anyway, I got the number and stuff for the medication, and I just checked to see how much it was in other countries, two in particular. In Canada, it's $8. In Mexico, it's $2. Could I go into Mexico and get it? Sure. Just take the prescription with me and go down there and pick it up. It's only a round trip, 8-hour, 10-hour drive. Yo, couldn't come out on that, could I? But what I found out was, so then I got to research. I thought, well, let's just look at all these Part D coverages. And the way it works is this. All Part Ds work the same. And Part D covers drugs. I love the label. Part D is drugs. Boy, sharp, right? Anyway, the lower the deductible, guess what? The higher the monthly premium. How genius. So if you want a low monthly premium, you pay a high deductible. You know? And it's crazy, man. It's just insanity. But it occurred to me, I didn't realize how powerful the pharmaceutical industry was, but I can see right now who runs the United States of America. Healthcare and pharmaceuticals. Because and throw in oil companies for flavor, but God Almighty, man, you know, generic, you can't get it a generic of this one, but you can get the drug in Mexico. You can't. They won't ship it to you from Canada though. They won't do that. They won't do it. Well, from Mexico, you can't get it done anyway. But yeah, if you wanted to get it cheap, you got to go to Mexico, or I guess you could drive into Canada and pick it up. But anyway, that's sick, and you know, and that. You know, it's it give you this year I think our increase in Social Security is going to be 3% or approximately, and the only reason they're doing that is not because they feel it's out of the kindness of their heart. It has nothing to do with it. What they're breaking into is this living wage. What they're trying to do is get money back into the system so that people will buy more stuff to keep the economy moving forward. You know, that's where you get the 4.2% growth, is by people buying stuff. If we're not buying stuff, down the tube we go. But yeah, so it's just a way to get money back into the system with that little raise, and then they take it. Well, there was no increase in the Medicare premium as far as I can tell, or as far as I know now. And again, the way it works for you new guys that are fixing to start drawing Medicare, or you're in your 50s and you've heard it but you don't know much about it, Part A covers doctor's visits. Part B covers hospital stays. If you don't have any other coverage, they pay up to 80%. Your monthly premium varies depending on how much income you have. I think mine's around $135 a month for Part A and B. Part D can be as much as you want it to be, because if you lower the deductible and you're taking some exotic drugs, your monthly premium might scare you to death. So having said that, that's just thought I'd vent a little bit on Medicare. And whoa, yeah, if you have to take drugs, knock on wood, I don't take any drugs. I'm 73 years old, but I thought I would check into it because of that stuff for your head. And no, I'm not going to pay that much. Hell no. I'll just, you know, she said I could use that CeraVe cream, probably do pretty much the same thing. But this stuff works quicker, or some kind, you know, actually all it is supercharged cream. But having said that, guys, just a quickie. Thumbs up, carpe diem, adios, bye-bye, buy anything you want. But if you think about it, use the link to Amazon products. Why? Because I get a small commission. Doesn't cost you one penny. What else? Drink plenty of water, stretch, walk, keep your health, because if you've got to take medication, you are screwed. I'm telling you, God almighty. I mean, I could see where healthcare costs could bankrupt a retiree real quickly. I can really see it. I can see clearly now. The rain is gone. Yeah, because they talk big numbers. You know, they don't mind telling you it's $100 or $500 or whatever. They don't mind telling you that at all. But anyway, enjoy your life, guys. Try to keep your health, though, or you're going to get caught in the pharmacy, Medicare, healthcare trap. And I promise you, if all the traps you don't want to be in, that's one of them. Adios, amigos. Bye-bye.